tattooing. Tattooing is a simple process. Before this procedure was even started, alcohol swabs were used to disinfect the skin. Using a pencil, rub graphite on the end of the stylus. The patient is moved forward and backward to reestablish the hinge position. The stylus is tapped onto the patient's skin. This transfers a pencil mark of the hinge axis onto the skin, and this is repeated on the opposite side. It should be noted when performing the hinge axis location, if the patient holds their head up off the headrest when the tattoo is marked, then the axis bow transfer also has to be performed with the head off the headrest. This clinician's preference is to have the patient keep their head against the headrests and do all the procedures with the head relaxed against the headrest. When making marks, be very careful not to stretch the hair because that too can move the skin, giving an inaccurate reading in terms of transfer. The patient has to be very passive with no smiling or talking when accomplishing the marking of this point. Once the lead mark has been made on the skin, the process then is to dismantle the clutch assembly, loosening up the screws, pulling the bar out, and taking the clamp off. Use a small screwdriver to split the clutch. As an aside, it should be noted that if one does this procedure long enough, an overzealous assistant will sterilize the screwdriver and melt the handle. Ideally, wax separates the plaster and the patient can bite the plaster off the teeth. This patient was able to bite the plaster, causing it to separate, and it came out really easy. Clean up the patient's mouth and remove all the plaster particles. When the oral cavity is cleaned, the tattoo is marked. Dip a 25 gauge needle into the tattoo ink. With the needle loaded, barely penetrate below the skin going into the dermis. Use a vibratory and rotary action to ensure the ink is deposited below the skin. In order to document the tattoo, place a ruler on the outer canthus of the eye to the tragus of the ear. Use a second ruler to measure up to the tattoo. Photograph this position. After a year or so, the tattoos will start to fade. Sometimes with rulers and photos, the tattoo can be relocated, thus saving a time-consuming redo of the hinge axis.